Hello, I'm Dr. Greer from Veterinary Village and Nature's Preserve Pet Care. And today I would like to help you better understand how we are different when you are planning for your pet's surgery. Judy will be helping by asking some questions, and I hope we're able to learn more about why choosing the right veterinary clinic for your pet surgery is so important.
So, Dr. Greer, what do you do for lab work prior to the procedure?
Well, we do a complete blood count or a CBC. That's going to check for any signs of anemia prior to the surgery, to make sure that there's no infection, to make sure that there's enough white blood cells to protect against the infection if it does occur, and that there's enough platelets to help the blood to clot after the incision is made. We also test the liver and the kidneys to be sure the anesthetic and the post-op pain medications will be safe. And if we have pets over the age of 7, we also do a thyroid test. For anybody that we do an open abdomen surgery on, like a spay, we also do a ProTime and a PTT to check the blood clotting to make sure it's also safe for the surgery.
Okay. And does my pet have a pre-op EKG?
Yes, and although we do a complete physical exam prior to the anesthesia, including listening to the heart, there can be heart problems such as an arrhythmia, an irregular heartbeat, that can lead to intraoperative complications, including anesthetic death. We can't always tell that from simply listening, so we do an EKG that's sent to a cardiologist for assessment prior to the anesthetic procedure.
Okay. And why does my pet have a shaved place on their leg? And do you use an IV catheter?
Yes, all the patients that we put under anesthesia for any time period more than about 5 minutes receives an IV catheter. That allows us to give IV fluids for support during the anesthetic period to keep their blood pressure up, and as well to give IV access if an emergency drug needs to be administered during the anesthetic procedure.
Okay. And what do you do with the IV fluids? Are those cold? Are those warm?
Right, that's a great question because room temperature IV fluids are pretty cold going to the vein. So we warm them, and that helps to keep the patient warm while they're under anesthesia. We have a little device that the IV tubing runs through to keep that fluid line warm. We know anesthesia causes a drop in the internal body temperature, so this is one of the several ways that we can help to compensate for that by using warmed IV fluids.
Okay. What is a certified veterinary technician, and why is that important?
We use certified veterinary technicians, or CVTs. That's required in the state of Wisconsin to be present during anesthesia. Our CVTs are highly experienced in the specialized care that's so imperative for safe anesthetic and recovery.
And what do you use for anesthesia?
There are lots of choices for anesthesia. We tend to use an injectable anesthetic agent, either propofol or alfaxin, which are very short acting. They are much safer for the heart and blood pressure than some of the other anesthetic agents that are commonly used in other veterinary practices. We feel much more comfortable with those two drugs than we do with some of the others.
Okay. And what is the tube in the trachea for?
Oh, that's another great question. The tube in the trachea keeps the airway open so that we can get oxygen in and out, so that if your pet has any opportunity to regurgitate, that it protects their trachea from aspiration. And most practices reuse the endotracheal tube, the trach tube, over and over and over and over. And I think that's, to be specific, kind of yucky. Reused tubes can spread disease. The disinfectant that's used to disinfect them can cause irritation of the trachea and a cough. Those tubes can get stiff and cause trauma when they're reused. And you may not be able to keep the saliva and the water out of the pet's airway if the balloon or the cuff on that tube is damaged. All of those things can lead to aspiration pneumonia. So we are very particular that the tube gets used one time and one time only, and then it gets donated to a local shelter for their anesthetic procedures.
Okay. And why do you use oxygen?
Well, oxygen is really essential to your pet's brain and heart, and we want to keep them well oxygenated during anesthesia. They tend not to breathe as deeply during anesthesia, so it's very important that they get 100% oxygen. There are some devices that are used in other practices that deliver a lower quantity of oxygen, so we like to have 100% oxygen from a tank being delivered to your pet during the procedure.
Okay. And what do you use to monitor my pet when they are sleeping?
Another great question. Besides our CVTs or our certified vet technicians, we use 2 surgical monitors. One is electronic, and that picks up the EKG, the blood pressure, the SpO2, which does oxygenation, the end-tidal CO2, which tells us how well they're ventilating, the respiratory rate, and the heart rate. Then we use a second one that we can use that actually we can hear the heart and the respirations on. So we just kind of double up on that. You can never be too safe during an anesthetic procedure.
Okay, great. And then what do you do for post-op pain?
Well, there are several things we do. One is we use intraoperative local anesthetic agents like lidocaine or novocaine as an injection or an infusion at the site of the incision. We use post-op and pre-op pain medication so that when your pet wakes up, they've already got that medication on board so that they don't wake up painful. And third, we use a post-op laser to improve wound healing and minimize pain. We also make many of our surgical incisions with a laser. Again, that helps to seal the blood vessels and the nerves. So all those things can really minimize pain. We want your pet as comfortable as they can be after surgery for recovery.
Amazing. Can my pet have post-op sedation?
Oh, yes. And there are definitely pets that need it. Some pets are too active after surgery, or they're more likely to play with another dog in the household. So if you feel like you have one of those dogs, by all means, ask us for post-op sedation so that when you leave the hospital, you have it in your hand. If you get home and discover that your pet is being more active than you expected, we can always get that medication to you later. But it's nice to have it the first night home so that if you need it, you've already got it in your hand.
And then how do you keep my pet warm?
Well, we use warm towels along with the warmed IV fluids, and then they wake up on a heated bed during the recovery as well. During the procedure, they're on a warm surgical table that's padded to protect the patient and keep them comfortable. So we do several things. It's the warm fluids, the warm towel, the warm table, and then a warm post-op bed.
And are there any stitches that need to come out after surgery?
Well, that depends on the procedure. Some procedures have the sutures buried under the skin, so you don't need to come back for anything. Sometimes we put the sutures directly in the skin. Those are stitches, and those need to be taken out by a pair of scissors. And frequently we use staples in the incision. There are times that staples are more appropriate to improve wound healing, especially if we have a young dog that's fairly active. They tend to leave the staples in, and they hold better than sutures alone do.
And then what kind of sutures do you use if you have to use them?
Right. And another great question. So there are several different kinds of suture material on the market, and we use only the best suture material. We want your pet to have the best wound healing that we can have.
And then what if there is a post-operative complication?
So 7 days a week, we're open at Veterinary Village. And between the two clinics at Checkout and Nature's Preserve, we're there 7 days a week as well. So each of those practices is open 5 days a week, but they have overlap so that we are 7 days a week at both practices. So Monday through Friday at Nature's Preserve, and then the other 5 days at Checkout. So we've got very full coverage after surgery. We're not 24 hours a day, but we do have 7 day a week coverage. So if you have a question, if you want to send us a photo, if you need something checked up afterwards with an appointment, we're happy to do that for you. We're there to help.
Now, if I have more questions regarding surgical procedures, what should I do?
Well, you can give us a call at the two practices. You can give us an email and we'll be checking those. After hours, we do have an answering service that has real people that answer. There are veterinary technicians that can also help you with any questions that you might have. So we're pretty much there to help you anytime. So please don't hesitate to call or send us photos if you have any questions that you need follow-up for.